Hi, I'm Addisu Mesfin. I'm a member of the MedStar Orthopaedic Institute, and as an orthopedic surgeon, I focus on spine surgery. So we detect spine tumors based on imaging such as an MRI, a CAT scan, and sometimes you can even see it on X-ray. For example, if the tumor has affected the bone, you can see a fracture. In that case, we end up ordering MRIs or CAT scan to look at it further. So this is an MRI of the thoracic spine or the trunk of a patient who has a metastatic tumor. The middle region here is an MRI with contrast, and when we administer contrast, we actually can see the tumor in a lot more detail. So the lighter area here is the bone that's been affected by the tumor, and this area right here is actually the part that has spread towards the spinal cord. Typically the spinal cord would look like this, and you can clearly see how much of it is getting pressed by the tumor. The next slide is looking at the spinal cord on MRI in a different manner. And here again, you can see the spinal cord is this region right here, and the lighter area is a tumor that has spread from the bone and pressing on the spinal cord. If a tumor is found in the spine, most of the time we do not need to operate. We can brace it, we can monitor it, we can also refer to radiation therapy or interventional radiology for less invasive management. If surgery is needed, there are several options which depend on the location of the tumor. For example, if it's in the thoracic spine or the trunk or the lumbar spine or the lower back, we can use minimally invasive techniques to stabilize the spine and to also take the pressure off the nerves. If it's in the neck, we have approaches where we can go through the front or the back of the neck to, again, take the pressure off the spinal cord and stabilize it. I've been a fan of less invasive techniques because of the fact that it decreases infections and also speeds up recovery. Posterolateral resection refers to how we approach the tumor that's sitting on the spinal cord or nerves. We typically go through the back, we resect the bone that's affected by the tumor, and then we take the tumor off the spinal cord. This allows for radiation or the treatments to be done afterwards safely. En bloc resection is a rare surgery that's performed for primary malignant tumors of the spine. These are chordomas, chondrosarcomas, or osteosarcomas. They're uncommon, and the approach to these tumors is a curative approach which en bloc resection provides. So here we're looking at an MRI of the lumbar spine or the lower back of a patient who has a lesion at L5. We can see how the lesion looks lighter here, and the bone also looks a little bit lighter compared to the other areas. So we biopsied this region and it came back as a chordoma, which is a primary malignant tumor of the spine. What we're looking at here is the L5 vertebral body for the patient resected in one piece or en bloc, which is a curative approach for this rare primary tumor called chordoma. Here we're looking at the instrumentation we placed after that L5 vertebral body was resected en bloc. This instrumentation is needed to stabilize the spine. We also placed a large cage which supports the area where the bone was resected. So metastatic spine disease or metastatic spine tumor surgery means that the tumor has started in a different organ. For example, it could be the lung, breast, prostate, or other areas, and then it invades the spine. The spine is actually a very common area for tumors to spread because of its high blood supply. The principle to do surgery here is to stabilize the spine because the bone has been eroded, and or to take the pressure off the spinal cord or the nerves to make sure that the person doesn't get nerve damage or paralysis. Recovery for this type of surgery depends on the location of the surgery. Typically, if it's done in a less invasive manner, the patient is able to mobilize the next day after surgery. Typically, we provide a brace for the patient to wear. There's physical therapy involved. The patient may be able to go home or go to rehab. We also work as a team with their medical oncologist and the radiation therapist to coordinate when the patient can start their radiation treatment and to also coordinate when they can have chemotherapy or other medications administered.